Welcome to Drunken Medicine, where we are drunk on medicine and we are passionate about whiskey. My name is Mike. I am an acupuncturist who's been practicing for an entirely long time, for 14 years now. And I've seen all sorts of things, everything you can think of, from vertigo to strokes to what we're talking about today, which is anxiety. Because actually, my undergrad's in psychology. So it's a huge interest of mine. Really excited. And with me is Dr. May. Tell us about yourself.
Well, I'm a naturopathic physician specializing in functional medicine and endocrinology. I've been practicing for 13, almost 14 years now. And currently, I mostly see endocrine disorders. So hypothyroidism, uh, cycle issues with women, low testosterone in men, things like that. So anxiety that we're talking about today has a profound effect on the endocrine system, and we'll talk more
Hmm.
about that. So I usually have to deal with anxiety or depression or any other sort of mood issues along with these endocrine disorders as well. So it'll be a fun topic to jump into.
That's interesting. And what are you drinking today? Anything? I know you're at work, so maybe not, but I thought I'd check.
Yeah, it's been a long day, so I wish I took my Belton Bridge back home so I could have at nighttime. So I didn't actually have anything here, so I'm drinking my turmeric ginger tea right now.
That's very healthy. Good job.
Yeah, but it's been one of those days where a nice little shot of whiskey would have been nice, but
I know
just
there's
didn't have
probably
any.
gin in that tea, and you start telling me.
Yeah, you know how much I love gin.
I'm just guessing.
What are you drinking?
Oh man, one of my old favorites, Highland Park 12, Vikings Honor. Let's see if I can get it in the picture.
Mm,
Yeah.
yeah, Vikings Honor. I like that.
It's a simple one. It's an easy one, but it's always delicious.
Yeah.
So this is cool, man. This distillery's been around since 1798, founded by Magnus Unsen, and supposedly,
Magnus.
yeah, Magnus was supposedly a descendant of the early Viking settlers. Who knows? They could have said that for advertising, but they
Mhm.
say that's the case. So it's
Nice.
nice. It's sweet. It's like sweet, cakey honey, but it also has that smoky peat. But it's not
Okay.
in your face like some of the other ones. It's kind of a more gentle smoke.
Yeah. Nice.
And it's
Nice.
43%, which is usually lower than I like for getting full flavor. But
Hmm.
for this, 43% is actually perfect. It's perfect. So
Cool.
it's a
Sounds
it's a
good.
nice one that you can just sip on and you're always going to enjoy it. It's never going to be offensive. It's not a 10 out of 10, but it's like an 8 and it's good price. So
Yeah. Nice. Very cool. Well, so I'm sure you sell more bottles if you say you're a direct descendant of, the original one, like Eric the Red or something like that.
you do. I'm surprised they actually sold a lot of bottles because advertising wise, like every other word is bolded with all capitals. And I'm like, that's a huge no no. But
Yeah.
they do well.
Yeah.
It seems like
Cool.
they're yelling at you the whole description. We're Vikings.
Well, that would be more like Vikings.
Give us your money. We're Vikings.
Yeah. We're plundering.
All right. So today's subject is anxiety. So why don't you tell us a little bit about kind of your perspective, the Western perspective of what is anxiety?
Yeah, this one's a tough one because there's no really good definition of anxiety. It's mostly defined by the symptoms that people experience. So anxious thoughts or restlessness or trouble concentrating or sleeping, fatigue, irritability, things like that. So it's more of it's more defined by how we experience it
Mhm.
than anything else. So, which is a sort of weird way to define a term. And I think for a lot of people, in my experience talking with people, like this is tough for them to express as well. So we use anxiety as sort of a broad term, sort of an umbrella term for a lot of different thoughts or sensations or things like that. So I think this is a tough one. It's a tough one to really hone in and define really acutely.
Yeah. So I mentioned before that my undergrad's in psychology. And so you're right. It's very much defined by subjective symptoms in general, where, if you answer 4 out of 7 of these, then you have generalized anxiety, or 5 out of 7. And it's just general things like, oh, I have these physical symptoms and I have these feelings of impending doom. I have these things going on, and you check the boxes. And if you check enough, congratulations, you have anxiety. So
Mhm. Yeah,
it's a little bit
yeah.
vague compared to a lot of the conditions we've talked about. It's very real, by the way. For anyone listening, I have anxiety. I've had panic disorder in the past. It's very real. But trying to describe it feels vague versus, a lot of the endocrine disorders and other things we're talking about.
Yeah. I agree. And, for years and years, I think I may have, um, just kind of easily glossed over, when someone told me that they had anxiety or maybe discounted it a bit. Because to me at that point, I think like looking back, I always had sort of a low level of anxiety for a lot of
Mhm.
reasons, but it wasn't until I actually experienced panic attacks that I realized, like, wow, this is something I can't control. Like,
Mhm.
this is a real thing, right? And it, it gave me a better appreciation for the whole experience of what anxiety is and what it does, and how it creates just so much chaos in your body.
Yep.
And a panic attack is terrifying.
It's hell. It's
It's
terrible.
especially for someone who's a control freak like I am. Um, Going through a panic attack where you have no control of what your body's doing at that moment in time is terrifying. And so I
Mhm.
definitely have a better appreciation for what people go through now that I've gone through it myself.
Yeah. And it is terrible. I've had panic attacks back years ago. And, my heart rate would just go up to 150 while I'm sitting, sweating,
Mhm.
shaking, I'm going to die. And it's not just like, oh, I feel like I'm going to die, but like if people have had panic attacks, it's like this sense of impending doom that's very real. Like it's
Yeah.
very much like this is happening. So this is something that a lot of people struggle with. And I notice it's actually been worse with the pandemic. I think being in the lockdowns and some of the other stuff, it seems to have come out a lot more in a lot more people. I don't know about you, but I've noticed that.
Oh, absolutely. Yeah. Anxiety, depression, everything in between. Yeah. Is just like been accentuated by the pandemic and
Yeah,
heightened at a level that many of us have never seen before. I mean, I deal
yeah,
so much more now with mood disorders and things like that than I've ever had to before.
yeah.
Um,
And I think
so,
also, we'll get, sorry, go ahead.
so I was just curious, like, this your degree was in this, so can you maybe you can explain this better than I can? Just kind of what's going on in our bodies when we're talking about anxiety.
So, from my understanding, because I'm not like a PhD or anything, but from my understanding, it's, you get a normal response. And a normal response is actually an anxious response. There are times to be anxious where you, you expect anxiety to spike whenever you find out somebody's in the hospital, when you find out somebody just died, when something's chasing you, something's trying to hurt you, like whatever it is, it's this burst and it's expected. So you get flooded with these hormones and you can function better, you can think more clearly, you can move faster. So it has a really good purpose. The problem is that it is supposed to go away.
Hmm.
So you
Right.
get this spike, and then once you're past what you're through, it goes away and you go about your life. But for people with anxiety, it never goes away. Generalized anxiety never ever goes away. It's all the time you're experiencing what somebody would be experiencing in a really scary situation, but you're experiencing it 24/7 and you just
Hmm.
can't turn it off. And
Right.
for panic
Yeah.
attacks, it's even more intense because you may have generalized anxiety, like a low level underneath, and then you get this huge spike, but there's nothing to run from. It's not like you're getting chased by a bear and you're scared. It's almost like you're paralyzed in this fear, and it's not useful at all. There's nothing useful about a panic attack. There's zero usefulness. You're just paralyzed and afraid, and it's not good.
Right. So it starts off as a useful, device for our bodies, right? To be able to
Yeah.
help us survive, right? So it's there for a purpose, but it's like oftentimes things that our bodies have sort of evolved to do for a specific purpose, a few hundred or thousand years ago, don't actually serve the same purpose or can be detrimental in a sense, in modern times, because, especially because in modern times, like our environment has evolved and changed at such a rapid rate in just
Mhm.
the last couple of hundred years. It's been hard for our bodies, like the human race in general, to adapt to that as fast as it's changing itself. So I think this is where there was this. I think the guy was German, if I remember right. His name was Hans Selye or something like that. It was several decades ago, like early 1900s. No, maybe he was Austrian. Anyway, regardless, he was, I think, a psychologist or biologist or something along that line, and he came up with this term called maladaptive stress syndrome. And so
Mhm.
he kind of talked through this of like, you know, um, this was something that was useful, and it's still useful in periods to get us out of a stressful situation. So if someone's, endangering your life or wanting to fight you, it could still be beneficial in that scenario to get you out of that stressful situation. But if this is you thinking about, a job interview and
Hmm.
having the same responses you would have, you know, uh, trying to fight someone, that's maybe not as useful for you, right? Or if it
Yeah.
continues, like you were saying, for a longer period of time, once that stressor is gone, but that process is still going. So your body's not adapting to stress the way it's supposed to adapt. And the way he kind of framed it was like you have this normal response, and then you can move into sort of this hyper vigilant response where
Mhm.
again that you're just upregulated and on high alert all the time. And then if that goes on for long enough, usually like months to years, you can move into that exhaustive stage, and that's just where you crash. So sort of the term adrenal fatigue could be something to describe sort of that situation,
Yeah.
where people have just been going 90 miles an hour for so long that their body can no longer keep up. And they've had
Yeah.
so many sort of secondary detrimental effects, like dropping in hormone levels like testosterone and estrogen and other things like that, that their body can't is no longer resilient to stress because they don't have the hormones that help them be resilient to stress
Yeah.
previously.
That makes sense. And yeah, and the other part of it, I feel like, is this is my hypothesis, by the way, but hundreds of years ago, thousands of years ago, people didn't have to be in their heads so much. Like they just weren't. It's like your job
Mhm.
was, some kind of physical labor, and you don't think a lot during physical labor about what you're stressing about. You're just working. If you've
Right.
ever worked,
Task.
if you've ever worked on a farm, I have before, and you're working for 13, 14 hours on a farm, like you're exhausted. Like
Mhm.
you are not stressing about what's going to happen tomorrow. You're tired and you're working and then you're
Right.
done and you go eat.
Yeah.
And our culture's changed. We're constantly thinking.
Yeah.
We have computers, we have phones. We're constantly thinking about something on our phone. We're looking at it, we're scrolling. Oh, I wonder what we think about this whatever political article, whatever pops up. We're getting
Yeah.
this constant barrage that's spiking these hormones in us. I mean, it's crazy. We're
Mhm.
basically feeding our fight or flight system constantly.
Yeah. And then we're not active. We don't have a way to dissipate that, for lack of a better explanation, like that energy that sort of builds up in us from being stressed out about whatever it is, that we're thinking about or doing. If we were working on a farm and laboring all day long, we're dissipating some of that excess energy, if you will. And instead, now we're sitting on our butts all day and thinking about stressful things, and
Oh yeah.
deadlines and stuff like that, but having no way to really dissipate that energy.
Yeah, and I think that's another reason why like a lot of the farmers I've met like live a lot of them live really well and really long. My grandpa lived to 85. He had a terrible lifestyle. He smoked like a chimney from 3 a.m. until he went to bed every single day.
Mhm.
And he was
Yeah.
fine until he was 80, 85 years old because he went and worked 6 days a week. He had a purpose. He didn't stress about anything. He
Mhm.
just worked on his farm and
Mhm.
he felt great about it. Like, and he had great health. He just didn't worry very much.
Yeah. 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 There's a lot to that. So, I mean, this kind of sounds depressing because we're building this up as this issue that seems really, really overwhelming. I'm starting to get a little anxious about
Sorry.
this, Mike.
Drink some whiskey.
So, yeah, right. Well, that's another aspect we should probably,
It's true. It's true. We'll address that sometime.
Yeah, coping skills. So we can get into that later. So all right. So this is, let's say, a natural response kind of gone awry and not benefiting us. So what are some things we could do to help kind of turn this around or reframe this?
So, and it's funny, you may have to answer some of the Western perspective because it's so funny. The Western and the Eastern perspective are so different. Like you already mentioned, some of it is, exercise is huge, good diet, going to sleep at a decent time, and then waking up rested. People with anxiety, it tends to get a lot worse whenever you have a sleep deficit. It just does because your body doesn't have time to recover.
Yep.
You can do some testing and other stuff, which we'll talk about later. I have some issues with the way that anxiety is medicated in the current system, so we can discuss that later because it's all assumed that it's serotonin, and it's not necessarily so. You can speak to that as well. Now, this has actually been talked about for 1,000 years in Chinese medicine, but they have some funny names for it. So fear and palpitations is one term. Another one is panic throbbing. So it's basically a panic attack, shaking in your chest, panic throbbing. And my favorite is rebellious chi of the penetrating vessel. So yeah,
That
great.
One still, that one cracks me up every time you say it.
It's that rebellious energy, rebellious chi.
I'm definitely going to be using that phrase again.
So the penetrating vessel is actually a channel that deals with fertility, believe it or not, but it's like a deep channel. And so rebellious chi just means like it rushes up. It's supposed to stay down and it goes up to your head and it causes anxiety. So, but it was a lot less of an issue 1,000 years ago. So they actually don't talk a ton about it. A lot of the theories that have come out have been a lot more modern because it's more of a modern phenomenon for the amount that we're seeing.
That makes sense. The whole rebellious chi thing. I mean, that's what we see. Like when people are really stressed, I see this because I do see a decent amount of infertility in my practice. And when we start looking at hormones and some of those hormones I test for, things like cortisol and epinephrine, which is adrenaline. And, oftentimes what I see come back is high levels of cortisol and adrenaline. And they correspond with low levels of progesterone and testosterone and some of those other androgens. And so it totally makes sense. Like that, these stress hormones and a lot of your sex hormones typically are diametrically opposed to each other, which makes complete sense in that, if your body's trying to survive until tomorrow, it's not worried about shunting resources to things that help you make babies, right? Like hormones and things like that. So it's going to shunt resources away from that. And I think we end up seeing that play out a lot in these cases of infertility.
That's really interesting. See, I didn't connect. Like, why does it have to do with the fertility channels? And that makes more sense now because I actually didn't know that. I learned something today. And guess what other organ is involved in this?
The kidney.
The kidney is also involved in this because it's involved with fertility. So it's tied in. You scored. You get a gold star.
I want my doctorate in Chinese medicine now.
Just say kidney for every answer.
That's right. It's like the C answer, I'm just going to answer it for everything. So.
But as far as what people can do for it, like, from other perspectives, we'll get to treatment in a few minutes, but you're asking like, what can you do for it now? You definitely need to be seeing a doctor. What you said is so important. Like get your hormones tested, get a full blood workup to see like, is there something else going on? And I'm not saying do not take SSRIs because they could be right for you. Completely possible if you have severe anxiety and you have a serotonin deficiency that it could be right for you. But don't assume that that's it unless other things have also been tested, because you could have dopamine issues, you could have epinephrine issues, you could have norepinephrine issues, you could have all these different things going on that they don't really test for. They just usually give an SSRI and say, try this and see how you feel in a month.
Yep. Yeah. Yeah. That is often the strategy is let's try this one. Then if that one doesn't work, we'll go to this one and so on and so on.
Yeah.
And it could be a bit of a roller coaster ride. So I'm totally with you there. Exhaust all avenues as much as you can first. If you can figure out the root cause, like do that. And never take. I end up saying this a lot with patients that I see on SSRIs or anxiolytics or any of those. This shouldn't be your only method of treatment. Like
Yes.
we know, like research study after research study has shown this, that SSRIs combined with cognitive behavioral therapy is exponentially more successful in treating several different anxiety and depression disorders. So you have to be able to combining those components together. You can't just pop a pill and expect your physiology to be miraculously better. You have to, because this is all about like your nervous system too, right? So your nervous system is like the sensory organ that senses what your environment is doing. And that's what's going to tell your immune system, your endocrine system, all those systems what to do and how to respond. So part of that nervous system is neurotransmitters like serotonin and all that. But the other part is just like framing what's happening in your environment. So it's like if you see a certain look on your wife's face that you interpret is a very mean look and that you're in trouble, you could start getting anxious based on how you interpret your environment, right? And it could just be like she was thinking of something and that was just her face, and she's not upset about anything towards you. But that's the way you're interpreting it, right? That's what your brain is telling the rest of your body, like, hey, we're in trouble. And it starts ramping up the heart rate, the blood pressure, and all the other stuff, right? So part of this is just reframing, how you're sensing your environment. And that part takes a lot of work. Yeah, it takes retraining. It takes someone reframing these things to you after you tell them, like, this is what I see or this is what I feel when I get in these situations. And so sometimes you have to retrain your body to reframe how you're sensing those things. Yeah.
You're absolutely right. I love it. Like you should not just be depending on medication. And again, I'm not anti-meds like at all when it comes to anxiety stuff, but you should, I mean, I see a counselor every week and have for a couple of years, and it's been super beneficial for me. And you're right about reframing too. Like I'm going to tell you something you're probably going to use against me, Ash. So there's a phrase that if I hear this phrase from anyone, I have a severe spike in anxiety. A single phrase. And the phrase is, I need to talk to you.
That's the phrase. Yes.
So, but it's funny. Like it's because of like past traumas and other things. I don't even remember why. But if I hear that, my heart rate will go up to 120. I'll start sweating. It's like a trigger. It's weird.
Yep.
And so I just avoid that phrase and like tell people who I'm close to is like, use a different phrase. Even if you need to talk to me, just use a different phrase.
Yeah, dude, I have a similar phrase. It's just, can we talk? And it's because one of my first jobs when I was in college was in this hospital. We were doing like cardiac rehab and exercise physiology type stuff. And I had this boss who just, I mean, she was very anxious and very like type A, right? And if you didn't do everything perfect, you got talked to. And that's how she would frame it. It's like, hey, can we talk? And you knew instantly you were in
Yeah.
So
Yeah.
I totally understand where you're
It's
coming from.
funny. It's funny though. Like when you hear certain phrases, it sets you off. So really, be getting counseling. If there's a medication that's working for you, that's fine. I would say that a lot of the research we have on SSRIs, which are the selective serotonin reuptake inhibitors, is for short-term use, and most people use them for long term. So most of the research we have is actually like fairly short term. So remember that when you're taking them is like we don't exactly know what's happening when you've been taking these for 20 years because there's not been a lot of research
Yep.
on it.
Yeah, especially the younger you are,
Yeah.
the more you have to really evaluate the benefits versus the risk. Especially people under the age of 25, like we definitely see a higher rate of suicide with those people that are being put on SSRIs and other medications like that because their brain's not even fully developed at that point, right? Their
Mhm.
prefrontal cortex is not fully developed. Like we still don't fully understand how it's affecting their brains.
Yeah.
So you just
For
have to
sure.
be super cautious.
Yeah. Yeah. And I was going to, if you don't mind, I'm going to mention we were talking about diagnosis stuff and I forgot. So in Chinese medicine, there's also, so we talked about the rebellious chi of the penetrating vessel. But each organ, I just love saying it. Each organ also is responsible for a different emotion. And so based on the emotion, you can actually treat different organs. So kidney is fear, liver is irritability to anger, and spleen is worry. So it's like there's these different things where if somebody's coming in with anxiety, I'll actually ask like, how do you experience that anxiety? What type? Because there's like, I'm fearful I'm going to die is one kind of anxiety, or
Mhm.
I get stressed out and want to break something. Those can both be anxiety. There's different types.
Yeah, yeah, that's very good.
Yeah. All right. So we've talked a little bit. Oh my gosh, we're gonna have to do a whole nother episode on this. So we talked a little tiny bit about anxiety and diagnosis. So, and you mentioned some drug stuff, but what do you do? And somebody comes in, you said you do testing, and I'm assuming if it's hormonal, you correct the hormones. And if it's not, what do you do?
Yeah, so that is part of the assessment is more of like seeing the effects of stress on the body. And so that's where we'll see like some of those neurotransmitters, like cortisol and adrenaline markers being elevated. We'll see like thyroid function start to be affected. So maybe not so much an increase in like TSH, but we'll see the conversion of T4 to T3 be affected. And we know that stress is a major component of that because it's a way for your body to slow your metabolic rate down under periods of continued stress, which makes sense again. Like if you're in the middle of a famine, you really want to conserve energy as much as you can. So when your body's stressed, it signals to your thyroid to kind of slow your metabolic rate down a bit. So we can see that occur in some of the lab findings, and then just like especially hormones. So for guys, if you got a 30-year-old guy coming in and he's got testosterone under 400, like that's a good indication he's got some chronic stress going on, or potentially other things, but chronic stress is a pretty good indication there.
Oh,
Or women
interesting.
who have cycle issues and low progesterone, especially luteal phase progesterone, like that could be an indication that there's some chronic stress going on as well. So it's more about just kind of picking up these little biomarkers in their labs that could indicate the level of stress. I mean, there's some really good labs like a Dutch, which is a urine and salivary test. The salivary part actually looks at their cortisol pattern through the day, which is really nice. So you can see like, are they spiking during the day when they're supposed to, like first thing in the morning? Is the cortisol actually dropping throughout the day? Or is their cortisol spiking at nighttime? And that's why they're not sleeping very well. And it's inhibiting some melatonin production. And, that's how stress and anxiety can cause sleep disturbances, right? Because how it affects your circadian rhythm and melatonin production and all that. So yeah, basically it's just like if you can see patterns, right? If you're seeing like thyroid not looking that great, you're seeing these other adrenal and hormone markers that are not looking so good. All of those combined together tells you a consistent story that there's likely some pretty significant chronic stress going on here.
Yeah, no, I like that. And it's funny because I've been dealing with anxiety, personally for a long time and then professionally for decades. And I've never heard anyone other than you mention some of like the sex hormone stuff. I just haven't. It's wild. So is that something that like a lot of medical doctors would not test for, do you think, or do they also start testing for it?
No, I'm not seeing it conventionally done. Like you'll see it in the functional medicine space, but yeah, it's not. I mean, you're right about the testing. Like, not much is done, if anything, even by psychiatrists. You rarely see much of any testing done. It's more of a, hey, let's try this medication and see how you respond, and then we'll make adjustments based on how you respond, either positively or negatively, whether that's adjusting your dose or switching to a different medication. So it's a bit of a like throwing darts. Maybe you're lucky and you hit the right dart or the right spot with it, but oftentimes that's not the case, and you just continue to try one thing after another.
Yeah. And I have a personal story on that actually. So when I was in college, I had anxiety kind of start up and they put me on SSRI. And because they don't test for anything, we didn't know that I actually have too much serotonin. And so it sent me into
Mm.
serotonin syndrome, which is not fun.
Ooh,
It's
no, it's
bad,
not.
bad, bad. And so we
Yeah,
had to,
that can be dangerous. Yeah.
yeah, it could be dangerous. I had to stop immediately. It caused some really nasty symptoms. And so that's why I'm really careful about, I'm really, really careful about this, is because you don't know.
Yeah.
You just don't know what's going on. You may have a dopamine issue. They may have there's all kinds of neurotransmitters. And so, yes, take meds that work. Also be careful.
Yeah. Nice.
And
Yeah,
you know what the
that's
biggest
great
treatment for
advice.
me has been, believe it or not, is weightlifting, working out.
Yep.
That's been
Yeah.
the best treatment along with counseling for my anxiety.
Absolutely, man. That's, I realized after decades of lifting weights and exercising and feeling like I'm kind of addicted to that, from like a physiological stance, that it was a way that I was treating my anxiety.
Yep.
It's like I had chronic, anxiety the past few decades, but I was self-treating with exercise.
Yeah.
And,
Which is way
it's like I
better
think a
than
lot of
crack.
people do that.
Yeah.
Well, yeah, that's true.
Way better. Good job managing it in a healthy way.
That snippet's going on TikTok right there. Uh, it's better than crack. But yeah, you're right. It's like, we can have positive coping skills and we can have negative coping skills, and those negative ones are really easy to start with, right? A little bit of alcohol, some marijuana or other drugs, food. Like, we can go to a lot of different poor coping mechanisms there that, we use just to kind of get through that anxiety, but they're not going to fix it, long term, and they're going to create their own issues from it too. So I think that's something, like, we've talked about this before. Like, we don't really teach, like, our kids or each other, like good stress coping mechanisms, right? Techniques. We don't learn how to breathe properly, how to deep breathe, how to meditate, how to do guided imagery or whatever, number of techniques that we could use to mitigate the stress reaction.
It's true. And you don't ever talk about it. It's like, I mean, it's gotten more talked about, but before, anxiety was just kind of something you kept hidden and just didn't talk about at all. So I'm glad it's finally starting to come out in the open and people are
Yeah.
actually talking about it, which is good. So treatment, I know we're running out of time. Working out, I'll have people work out, eating
Yep.
healthy, not eating a bunch of garbage, eating at reasonable times and not, starving yourself and then eating all at once. I mean, and I'm not talking about intermittent fasting. I'm talking about just like, you're stressed. And so you don't eat. And then when you do, you stress eat. That's not
Yep.
good. Um,
Yep.
so making sure your diet's planned, I will say, it's like, kind of what you're doing with it. And if you have triggers, figuring out how to deal with those in a healthy way,
Mhm.
And then acupuncture, of course. I'll ask what emotions they're feeling, how they experience the anxiety, and then we'll beat down that rebellious chi. And so,
Yeah. No, I've seen, I think acupuncture is one of the strongest treatments for anxiety or any area of like the nervous system. So I think that's why it's great for pain, for uh, gut issues that are sort of nerve related, like irritable bowel and things like that. Like it's just phenomenal at sort of altering the nervous system in
yeah,
whatever way that you need to, right? And so I've seen acupuncture be extremely effective for anxiety. Yeah, if you're out there and you're experiencing anxiety and you've never tried acupuncture, please start with it because it's not going to make anything worse. If anything, it's going to be phenomenal for you. So that's a great place to start. And I think you're right. I agree. Like you first have to work on those foundational things too. So, hone in your nutrition, eat regularly. The issue with carbohydrates, especially when you're in a situation of chronic stress, is remember cortisol is what we classify it as a glucocorticoid. So the way that it works is when it's released, it can signal to the liver to dump a bunch of stored sugar into your bloodstream to raise your
Mhm.
blood sugar. That's how it helps you run from the bear, right? And so when your stress levels are high, the stress hormones are high, it can drive your blood sugar up as well, which
Huh.
then can also crash and cause you to crave more carbohydrates and things to raise your blood sugar again. So then you get on this roller coaster ride of blood sugar, up and down based on both your your adrenal hormones like cortisol and your carbohydrate intake. So that's part of the diet issue you kind of have to be aware of.
Interesting. Yeah, and that actually makes a lot of sense. It's like your body needs to be prepared, but not all the time. You'll
Right.
need sugar all the
Right.
time to be running.
Yeah. Yeah, absolutely. Absolutely. Other things from me, I like to start with something called L-theanine, which is it's an amino acid, but it's been shown to help improve serotonin, uh, dopamine levels, GABA levels in the brain. There's actually some really interesting studies on it to sort of dissipate the effect of caffeine on heart rate and blood pressure. So we see that if people are taking L-theanine and then they intake high levels of caffeine, which I think in one study was like over 600 milligrams a day, which is quite a bit. It actually blunted the effect that the caffeine had on their heart rate and blood pressure, so that
Huh.
their blood pressure and heart rate didn't spike as much as not being on the L-theanine. So that's a good one. It's not a sedative, so it's not going to make you feel fatigued during the day. It's just going to do a good job of sort of lowering that threshold a bit. So that's a great one I usually start with.
Yeah, and I'm glad you mentioned caffeine as well, because too much caffeine can make anxiety worse. So if you're somebody that struggles with anxiety and you love your quad shot venti latte at
Right.
Starbucks, this could be contributing, even if you feel like you need it to get your day going.
Yep. Yeah.
So,
Yeah. I also like adaptogens. And so this is a sort of a class of herbs that includes things like ashwagandha, maca, ginseng, um, you know, what's another one? Um, astragalus. Like these are all that they're in this class of adaptogens because they actually help your body adapt to stress. And so again, kind of like the L-theanine, they don't allow you to sort of get ramped up as much. So they help kind of keep you lower key so that you're not experiencing as much anxiety. So those are great ones to combine too. I like, combining a bunch of them. Sometimes with women, especially ashwagandha by itself works really well. Um, but I tend to kind of go with formulas when it comes to those.
nice, nice. And I like the adaptogens a lot. A lot of the Chinese herbs we use are adaptogenic. And then for acupuncture, I didn't mention specific points. I want to talk about my favorite point before we go. The name of the point is Valium Tranquilizer. Valium Tranquilizer. It's a new point.
Nice.
And because it will knock you out. It's so you can't see if you're listening, but you have like the big part of your ear and then you have the little part of your ear. I'm not using the technical terms. The little flabby part that sticks out. And if you push right in the middle of that, that's where that point is. Really, really beneficial for anxiety.
Yeah.
Very, very
Isn't
helpful.
there one like in the web of your thenar process there?
Yeah. So if you take your first finger and your thumb, there's the web there, and the biggest, meatiest part of that, push on both sides, and it's going to hurt. And then you found the point. Yeah. Really good for stress and anxiety also. And you can do that at home. You'll find it because it hurts. So if it hurts, squeeze it.
Yeah. That's when I think you showed me that years ago. That's when I still kind of go to myself. When I'm starting to feel, anxious, I'll do that on both hands, and it does work. Yeah.
Nice.
Cool.
Well, we're running out of time. This is a good time to wrap up, but we're going to have a whole nother episode on this because this is awesome.
Yeah. I know we didn't get to near what we wanted to today, but we have some time restrictions, unfortunately, today.
No
All right, man.
problem.
Anything else you could think of?
No, we appreciate y'all for tuning in. And this is awesome. We're looking forward to doing more shows. Oh, we want to apologize to our listeners because we were supposed to do shows when we were in Alaska and we both got so busy it didn't happen. So sorry about that.
Yeah. I mean, it was a bad problem or a good problem to have, I guess. We were both busy seeing patients there, and we just got way too busy to be able to record anything. But we're going to try to catch up here and give you guys some more shows coming up soon.
Cool. Well, thanks, man. I appreciate it. This is a blast, and it's good to see you.
All right. Likewise. We'll see you guys next week. Take care.
See you.